Now in total 1,002. And there were various activities taking place. The patients were seen, examined, and then some were given treatment. Others had cancer cervix screening, and some had surgery. And for the last 2 days, I was mainly in theater. So that's why I'm not very well abreast with the numbers, but I know the numbers are there. Now, the cases that we did in surgery, I think by the end of today, in total, would be 18. But I know we have others that we may. Now, the two cases that we worked on, which I just want to give a brief, is that one, we had a lady who is 32 years old, and she has had 4 children. Her first delivery was when she was 18 years. But at that time, she developed a tear in her birth canal. And she has been having problems in her family. She did not get any treatment, but when she heard of this camp, she decided to come. And when he met us, she said the husband was now trying to get another woman because their married life was not okay now. And because part of our problem was also that she could not control gas, and sometimes even stool would come out, and because of that she also fears now going to social gatherings. In fact, she even pleaded with the team that this time now don't let me go without having the service. I'm happy to report to you that this lady, we worked on her 2 days ago and she was discharged. We are expecting her to heal well without any problem. The second case is a 44-year-old lady who for the last 4 years has been having problem of irregular bleeding, and for her she thought this was menstruation, but she also developed something which she saw she could feel in her birth canal, and her bleeding would not stop. So when we saw her, and from her history, one of the major things also in the history was that because of that, those bleeding that have been constant, she has had several blood transfusions. But when we saw her, we found that she had something coming through her cervix, and of course in medical term this was a cervical polyp that was coming right from the uterus. I know these days most people know fibroid, so this was a fibroid that was growing from inside and therefore was coming out. I'm also happy to report to you that we worked on her and she's recovering very well. She's still on the ward.
An MCH camp is organized
probably in northern Uganda, in Lira, in northern Uganda, and in Uganda. We saw this as a niche because previously other organizations, other hospitals, other facilities have organized other camps. But we saw that there was not a camp organized specifically to address the reproductive health of a woman. And we thought this camp was going to do it, and we saw the mammoth crowd, the mammoth turnout, the number of mothers, and others were calling me at night. We are coming tomorrow. Are you going to be there? I didn't until this afternoon. Others are calling me. Can I still come? So I think this was a niche which was not addressed before, and I thank the wisdom that led us to organize the MCH camp and give service to our mothers. I now want to report that we have been very successful. Initially, we thought we were being very ambitious when we said we want to see 1,000 mothers in 3 days here. And indeed, I want to report that over 1,002 patients came for this consultation. And it was not only consultation, these mothers and children needed to go to see doctors, needed to go and receive services. And our services went into very many areas. We went into the lab, we went to do ultrasound and X-ray and so on and so forth. So allow me to report that in the last 3 days, over 650 tests were done in the lab. Over 402 ultrasound scans were done. Previously, we used to do only 18 ultrasound tests per day, but this time we did over 400 ultrasound and over 70 X-rays. We also, in the camp, we have said that we noticed that many were not sensitized about HIV tests and counseling and tests and initiation treatment. I want to report that during the camp, 79 mothers came for HIV tests, and I also want to report that cervical cancer screening, which we now know Uganda is the 6th country with the highest mortality due to cancer of the cervix. Over 139 mothers benefited from this service. Family planning was one of the services offered. About 12 mothers received family planning services. Antenatal were about 50. So in the community out there were mothers who were treated and never came. But during this service, that they had us on radio, that they had us in the media, over 50 mothers came and got antenatal care from here. We stole the show because we decided that let us also use this opportunity to screen mothers for cancer of the breast. Your worship, the chief guests, I want to bring to your attention that the number one killer of mothers is cancer of the cervix followed by cancer of the breast. So we do not want to lose any opportunity. So we screened 140 mothers who came here for cancer of the breast. Children also came. And I want people who are listening to me, mothers and parents, that they have children whom we don't even know that they have conditions that need treatment. Because out of the children who came, we discovered there are 10 children with undescended testes. This is a condition that, if not treated in future, may lead to infertility. So that these children, 10 of them, who came and we assessed them, and then I also want to report that the total team were very active, and 18 surgeries were done. So So these were the outputs for the MCH camp. Remember, MCH camp, we said we are going to address issue of fertility, issue of family planning, issue of cervical cancer screening, HIV testing, nutrition. I want to report that nutrition, all the mothers who came here today, from the day of the camp up to today, we are being taught the appropriate way of cooking. Because some of us, when we are eating, I also need to know this until I attend this session. When we are cooking, we don't know how to cook greens. We cook greens until it is so soft and all the nutrients would have been burnt in the food. So all the mothers left here when they have learned how to cook, how to improve their nutrition, how to cook food in a way that will improve nutrition of children and of their family. So the camp was very successful. I now want to say that I used the opportunity to see another show, that I used the opportunity to approach our team members from Pool Africa Link and tell them that you have come for the camp, thank you, but I want an equipment from you. And indeed, I received a donation of money to buy an equipment which will be put in place. I want to conclude by thanking all the participants, particularly starting with the patients who heard us and heard our announcement, our media output, and responded in the numbers. I want to say that by around 11 o'clock, some will realize we are not going to finish and will ask others that wait for the next time. Otherwise, we will have continued today and maybe tomorrow, or maybe tomorrow next, that colleagues, everything which is good, at least one time has a day it ends. So I want to thank my colleagues, the health workers. You have made us very proud. You have made Lira University very proud. You have put Lira University on the map of Uganda. You have made a signature that will never be forgotten. Lira University staff, I want you to clap for yourself once again. We really appreciate you. The Vice Chancellor, I want to report that these people work tirelessly. Most of them were living here after 11 p.m. They came in the morning, they worked, and at one time they called me and said, how are we going to go home? I want to direct the ambulance and the white pickup stay parked in the hospital and be ready to drop people who are ready to go home. And this work was successful because of the commitment this staff in years showed. It is the first camp that we have organized in Lira University by ourselves. You have proved that we can do it.
At the university,
our guest of honor is making his way to the tent. Let's put our hands together and give them.
How did this camp come about? When we visited Lira Regional Hospital during that visit, we met so many clients. Some were seated at the veranda and some were standing. They were very sick. And we said, I think we need to have an option for these clients to come to. So we thought, let's have a camp. One, to publicize the hospital, and then two, to provide an option for these clients whenever they need the services. And that came to pass. Today we are witnessing the closure of this camp, but the last 1 week has been a big success. One, because the team of doctors, the team of nurses and midwives, the team of security officers, the team of labs, radiology, cleaners, theatre, everyone has been very, very committed to their work to ensure that this camp will come to pass. I am therefore going to write a comprehensive report, share with the team, and also share with the funders. But I must say that you should receive my sincere gratitude, the team, for having been a very committed team. And I pray that next time we organize another camp, please come and support the way you've done to this one. And to the administration, I can only say thank you, because we are here because you've given us the opportunity to do our best and to provide the services. We shall always do our best to ensure that our clients receive the best of care. Finally, to the city authority, through His Worship the Mayor of Lira City, we have had to come round here for 1 week with very, very peaceful environment. And this is because you have made it possible for us to move and ride without any trouble. Thank you so much.
Development in this region and beyond. This camp was held when we observed that around us there are people who are suffering, and they are not coming. Our words are very smart, but they are empty. We have done our work, we have gone around, because we have a very active faculty of public health. That's the faculty that goes around to determine the problems of health in the community. We realize that people do not understand what takes place in the teaching hospital. I have met mothers carrying their children past the hospital, past the university, and when you ask them, say, I think we cannot afford that one. How can we go to the smart hospital like that? Shall we afford? Some who have been convinced to come have realized that they have been wasting their time. People have started coming. They come and get not better treatment, because in medicine we offer the best treatment wherever you are. So we're not going to say we offer better treatment or what. No. We must offer the best treatment, because that's what we took the oath to do. In ending my speech, when we were asked to start a university in this sub-region, they asked what we wanted to start with. Some were saying we start engineering programs. Some even suggested space science. We said no. We want to be relevant to the community where we live. Space science is there, yes, but how many of our people here would benefit? Even engineering, we already knew that we have a technical school, technical college here, which was producing very good artisans. But health-wise, we were not doing well. I want to assure the mayor and the press that soon or later the teaching hospital is going to be a center of medical tourism. We've started small, but that's where we are going to end, because the teaching hospital attached to a university will attract the best lecturers and the best practitioners. As I speak now, we're having a team, I think from the UK. And right from the beginning, 10 years ago, we have had international teachers and practitioners coming to work with us. Simply because we decided to say this is a teaching hospital belonging to the university, and the people out there, they always want us to save themselves with teaching, but they will not want to come and help you treat patients, your own patients, without you participating. So for this reason, our next plan is to expand the hospital. This expansion will include a hotel, a 5-star hotel. Because we are looking at medical tourism. People will be flying in here. And that is, in short, what a teaching hospital attached to a university means. We have not gone too far, but this exercise has encouraged me.
The principal investigator for the project that we are witnessing today. The invited guests, the staff of the university hospital, the students, and all my colleagues. I'm very happy to have this opportunity to explain what has already been going around. The first thing was, what's a teaching hospital? What is different? We already have the regional hospital in Lira and other hospitals. What is a teaching hospital? Is it different? I will excuse you if you are having such a question. I'm happy that I'm going to have the opportunity to explain that today. Secondly, this is the first teaching hospital in this country. Well, even some of us were trained in hospitals, but they are not actually teaching hospitals from the beginning. We are using the facilities of the Ministry of Health, and there are lots of problems. So a teaching hospital, the Ministry of Public Service is having problems creating it. Is it a district hospital? Is it a health center 4? Is it a health center 5? Is it what? Is it a national referral hospital? No, it is none of those. You want to know that the best hospitals in the world are the teaching hospitals, because when you hear presidents going to India, our late president used to go to Italy. They go to teaching hospitals. There is one also in Egypt. They are the best hospital that they can go to because these good doctors and nurses and other health workers are trained there. The people who know it best train them from there. And to research and evidence based. They don't do things by trial and error. So a teaching hospital, it is free to do everything else which is done in other hospitals, but they specialize in teaching those who are going to do the practice. I want to give you some example. In this country, I think it was developed about 5 years back. They are talking about competency-based curriculum or learning. There is no other good example than what you are seeing now in Lira University. It means that when a student comes out of the training, he's not going to start learning again. He comes out already polished, just going to start working. He will have been taught, trained, and has become very competent. And that's what is happening here. You want to know that we've started a medical school here to train doctors. We're having nurses. I think we have now started training nurses also, and midwives. These ones, when they finish and get out, will not need any further training. They go out with the competencies in their hands. They will not need to look for internship because they already know. They have learned. That is, in a sense, the difference between a teaching hospital and an ordinary hospital, whatever level. Since Lira started this, there are many universities that are beginning to think of going the way we are going. I wish them well. The issue is that we shall continue leading and they will continue following. Another issue with Lira, a very little known university. We don't pride in the size of the university, but we pride ourselves in the products that we have. Our products are performing very well. They have started scrambling for graduates from Lira University, and I followed and found there's a very good reason for that. They have formed the backbone of many hospitals and universities. A little about the history here. How did you start and why?
What Lira University Teaching Hospital can
The
do,
university,
and the
like
members of
any
our
other
community
training
can
institution,
now bear testimony that we
should
have
be relevant
to attend
in
to
the
this
community
huge number of clients.
where it is
On each day,
situated,
we are receiving on average
and it
300
should
patients here. And
form part of a development agency. We have established Lira University as a community-based institution that is relevant to the community from the outset. If it is just a university, we'll be having students completed here. They will walk out with very beautiful papers, but unable to do anything, even to support themselves, leave alone supporting development in the community where they live. I'm proud to mention that graduates from this university are working out there. Many of them are not looking for jobs because they already know what to do with the knowledge that they have acquired. They don't only acquire the knowledge, they work out with a lot of skills, life skills in their hands. I shared this morning about the products of Lira University. Some doctors are already heading big hospitals in this country. And that's not a small thing, because we hardly 10 years. We shall be 10 years next year. But we are already shining out there. I enjoy traveling throughout the country and also internationally. I find graduates from Lira University shining. Your Worship, the Mayor, and members of the press that are here, let me welcome you so much for this occasion. It is when you, as our liaison, are going to explain to the community nursing and midwifery has grown from nothing to now health workers, particularly nurses, that have completed the highest degree in the program. Your MC here and others are now pursuing PhD degrees. Unlike in other universities where they are saying nurses cannot get up there. We have proved them wrong. We are going to continue. We are not going to stop. And we shall encourage them to follow us. I want to thank all of you for what you've done. And for today, my colleagues, I don't want to think that you are workers, because I'm also a worker. I always want to refer to you as my friends, and it's true. I want to encourage you. There are those of you who are not sure whether they are coming to Lira University or not. But I want to thank you for believing in us, because it was very difficult to decide to come. Where is that place? What are they doing? This and that. I'm happy, and if there are any issues, we can always tackle them together.
The idea will now be anchored on how do we mobilize possible funders. There's somebody who believes that money is not the problem, it's only the idea that you are able to sell, which is the challenge. If you can sell a good idea, many people can buy it. So let us ambitiously think that we can do twice a year. The university has been working so closely with Lira City Council and will continue to work with Lira City Council closely in order to remain relevant in this community and also to help shed light to those who do not understand this university, and also to sell the region to other places. I like it when the Vice Chancellor says we are now heading for medical tourism. That is the right place for us, and we need to connect quickly with the other associated development that are coming here. I'd like to remind the students who are here and also members of the press that Lira University has teamed up with the Ministry of Health through our very own, the Minister of Health, who is also the woman member of Parliament for Lira City. And in this place, we already have the construction of the blood bank going on. We've been promised that there will be a section for the Heart Institute, and then possibly also for the Cancer Institute. So we're looking forward to see all this expansion as envisioned by the university, also linked with the development of the city. At the local government level, as a city council, we also agreed to work together with the university to support training of our students by using our facilities, the Center 3, which is just very nearby. But I also want to announce that recently, Uruluru Health Center 3 has come on board. So, which is also not far from here. So you have enough space where you can deploy students to go and serve the community as they learn the hospital and also the health center environment. So as a city council, I can say we are committed and we shall continue working together with you to make this university one of the best, first of all in the country, and also, as we said, to the world, to become one of the best in the world. Recently, I also met a team from the Quality Assurance Department. This is not related to this camp, but it can be connected. For instance, when you're aware, in many of our meetings, I've been raising the issue of the university helping Lira City Council come up with proposals that are sellable to UNESCO. Lira City is one of the 3 learning cities in Uganda, and also one of the founding members of the African Learning Cities. So this week, our team from the Quality Assurance Department, together with those from the Education Department, came to my office and we spoke about how can we make this possible. But like I said, this can be part of the hospital in a way that we bring in community health engagement, because we are looking at having mothers in groups under their classes, which we normally call functional adult literacy classes. But we want to add entrepreneurship to it. Now that I'm sitting here, I think we can add health matters to it. So we have a complete package. And when we are meeting these mothers, we talk matters about their literacy, we talk about matters of their entrepreneurship, and we also talk about matters of their health in one stop, so that when they live complete human beings. So we are going to be able to do this when we continue thinking together and linking the services that this university can provide to this community. I think those are the few I can raise for the knowledge of the others who are not part of this community every day, and for our students, and to assure us that we are working together. So I think I now come to the final task. Once again, salute you and thank you all for serving our community, for making us proud,